started this conversation series back in December because I saw a need for mental health professionals to figure out strategies to deal with their biases that come up in therapy in their professional spaces, and to navigate discrimination that might show up in therapy. When I consider the future of mental health, we know that technology will be playing a greater role. If you're a digital native, someone born after 1980, this is obvious and inevitable. But if you are a digital immigrant like myself and my colleagues, this seems like an absolutely terrifying possibility. So we hold on to the fear and bury our heads in the sand and hope that it will pass. But one thing we know for sure is that technology is not going anywhere. It's here to stay. And in fact, it's only getting faster and more sophisticated. As a result, our ethics and policies and practice are way behind. So technology in mental health is an area of uncharted territory.
I am a male, cisgendered, and I'm mixed race, Chinese and white Jewish.
For me, empathy and taking care of other people and helping other people kind of find themselves was just always a part of my psyche.
My parents are both from India, and I think it does impact, my relationship with mental health only because there's more of a concept of like you're one with your family. There's less individuality in the Indian culture, so the idea of going to a therapist is just like a little strange for us.
The average iPhone user touches his or her phone 2,617 times per day. Basically, 2,617 potential intervention moments where if we have accessible services ready to go, we can really meet people where they're at.
80% of kids between 18 and 24 are on Snapchat and Instagram. We're trying to leverage social media to prevent mental health crises and promote wellness of young adults, particularly with those with marginalized identities, because again, social media can be a positive when they can find a community and they can express an identity that might be suppressed.
There's some things that are actually more effective in a teletherapy scenario. So, for example, people admitting something that they're ashamed of or that's difficult to talk about. We've particularly seen this in studies with veterans that are getting treatment for substance abuse. So I think it's really important to be thinking about access beyond just helping out people that are perhaps physically disadvantaged, can't physically get to a therapist.
Really encourage you to bring technology into the therapy room. So we really need to enter the conversation with an openness and non-judgmental stance to try and understand what their experience is like. But I think if we recognize 2,617 taps per day, and we're not even gonna ask about this aspect of their lives, it feels like such a missed opportunity to understand something that we know can have a really consequential influence on their everyday lives.
I kind of continue to bang the drum on like, this isn't going anywhere, guys. Like it's not like we're just gonna forget about teletherapy and it's gonna disappear. Like you're gonna be doing this at some point, it's just when.
Really think about the data and who is using technology. We're seeing technology not going away. Most people in the world, in the US, have access to internet and our cell phones, and how are we really going to use that information to go where clients are at. In my generation, I think focus on the negative pieces, but really how we're embracing and understanding through the lens of our clients how technology impacts their lives. Like that's such key information that we need to know. And if you're not connecting to their social media world and not understanding it, you're missing huge amounts of information about their lives.